Hi, Dr. Harrison here, and today I'm going to discuss headaches. Headaches are one of the most common conditions that I see in my office, and people sometimes get confused about what type of headache they actually have. So I just want to go through the different categories of headaches that we see in the office and let you know what the differences are and how we kind of differentiate them. So the number one most popular, I would say, or most common type of headache that we see in our office are muscle tension headaches. These make up about 90% of headaches. Usually they develop due to stress or muscle contraction in the neck and shoulders. Usually we'll feel pressure around the base of the skull or the top part of the neck. And they usually start in the back and sometimes will radiate around to the front. And again, these are muscle tension headaches. They make up the majority of the headaches that we see. They respond very, very well to adjustments, sometimes massage therapy, stretching. Many times we can get rid of those headaches while the patient's in the office. So good news for those suffering with headaches is 90% of what you have probably is muscle tension. Responds very, very quickly to chiropractic care. Usually a handful of visits and most people are doing much, much better. So that's the most common type of headache that we see. The second most common type of headache that I see are cluster headaches. They occur in men more than women, and they call them cluster headaches because they tend to come in groups or clusters. For example, you might go several weeks without having a headache at all, and then 3 or 4 days in a row you may get these cluster headaches. Usually they're pretty severe and they're of a sudden onset, and typically they'll affect one side. So usually the area of the eye, many times you'll get tearing in the eye, you might get some sinus congestion, maybe some restlessness and you feel like you just need to go lay down. But these are pretty severe headaches. They're of an unknown etiology. Nobody really knows what causes the cluster headaches to come on. We just know that they're more common in men than women. And typically, again, they come in cycles or clusters, hence the name cluster headache, and usually they'll affect one side or the other around the area of the eye and sinus. So that's a typical presentation of a cluster headache. These again will respond pretty well to treatment. Usually we'll see reduction in frequency and intensity with chiropractic care. So in my opinion, probably some degree or involvement with the neurological system, and we're taking stress off those nerves when we do the chiropractic adjustments to the neck area. Maybe some light cranial work, which I specialize in and do in the office. And so again, cluster headaches respond pretty well to chiropractic care, and we have great success there. So the next most common type of headache we see in the office are sinus headaches, and sinus headaches typically are going to involve obviously either a viral infection, maybe a bacterial infection, maybe just allergies that the patient's suffering with. If there is some sort of bacterial infection, the patient obviously may need a round of antibiotics to clear up that infection. However, outside of that, people with just general sinusitis or viral respond very, very well to acupressure points, chiropractic adjustments to the neck, and I'm certified in acupuncture, and we have great success with just straight acupuncture and relieving sinus pressure and helping with the drainage. The next type of headache that we see are what we call rebound headaches. Rebound headaches occur when people are coming off certain types of medication. Maybe your doctor, following a surgery, for example, had placed you on some sort of painkiller or anti-inflammatory regimen, and you've been on these pills for a period of time as your body's going through the healing process. Now it's time to come off of these, and the body has either become addicted, if sometimes it's an addictive type painkiller, or maybe just a rebound on coming off of anti-inflammatory medications. Now the body's having a rebound inflammatory response. So typically these patients respond very, very well to adjustment, light therapy on the neck and shoulder region. Typically these headaches are short-lived. The patient goes through a period of 3, 4, 5 days where they're having these rebound headaches and then they're fine. But typically if we can get in there and adjust the neck, maybe do some light stretching, it'll alleviate these headaches on the spot. So we have really good success with those rebound headaches as well. The last type of headache that we see in the office, and this is one that almost everybody has heard of or familiar with, and that is migraine headaches. Typically these are very severe headaches. Sometimes a patient will have an aura that they experience before the headache comes on, so they kind of know when it's coming. And typically they last anywhere from 4 hours to as long as 72 hours, which obviously is a very long time to have a severe headache. And if you've had this happen more than 5 times, then your doctor will typically label you as a patient suffering with migraine headaches. We've had really good success with adjustments and therapy, even some light cranial work, in relieving the severity and the intensity and the frequency of migraine headaches in our patients. Sometimes dietary changes can be helpful, but these patients typically do respond to just straight chiropractic care, maybe some physiotherapy like muscle stimulation, heat or ice, ultrasound to the neck, shoulder region, and we see a great reduction in these migraine frequencies and their intensities. So if you're suffering with headaches and you find yourself in one of these categories, please feel free to contact the office. The consultations are always free. We'll determine what type of headache you have and the best approach to alleviating your headache pain and making your life a little bit more enjoyable. You know, the one thing I find funny when patients come in, I always ask, do you have headaches? Even if they're complaining of neck pain, because many times they'll come in conjunction with it, and they say, well, I just have the normal headaches. And I said, well, what is normal? And they say, well, I just have them about 3 or 4 days a week. And my jaw about hits the floor because they become so accustomed to having them that they think it is the norm. Well, it's definitely common, but it's definitely not normal. So please, if you're suffering with these headaches, you don't need to call the office. Let's see what we can do to alleviate them so you can enjoy life a little bit more. Hope this information has been helpful, and I look forward to seeing you in the office.